Hello everyone, I'm Ummi. Today, I would like to introduce you to an extraordinary individual who, at 70, battles psoriasis every day. Beyond his personal struggles, Thiru champions the cause as the president of Persatuan Psoriasis Malaysia, offering hope and help to many. His resilience shines through, having also defeated COVID-19. Stay with us as Thiru shares his inspiring story of courage and commitment.
Hi, Umi. Thank you for having me here and thank you for your kind words. When I was first diagnosed with psoriasis 40 years ago, honestly, it was quite a struggle. I had many aspirations and adjusting to the reality of this condition was incredibly tough. Psoriasis, as you know, Umi, is an autoimmune condition that causes inflammation and unpredictable flare-ups in my skin. Besides psoriasis, I also have a heart problem, which makes things more difficult. Since COVID-19 started, I must be extra careful as the virus poses a serious risk to someone like me with existing health issues.
Dealing with psoriasis and a heart condition at our age must be incredibly challenging. I can understand how difficult it must be to manage these conditions as we get older. I also learned that during the peak of the pandemic, you contracted COVID-19. Could you share with us how you navigated this additional health challenge?
My first bout with COVID-19 2 years ago hit me hard. I felt weak, suffered from body aches and headaches, and even had a fall in the bathroom due to my weakened state. It took me about 10 to 12 days to begin feeling normal again, which is longer than usual. I think my age and existing heart condition might have played a part in that. Having COVID-19 when you're already at high risk certainly complicates things. There was a constant worry that my immune system might not cope as well as others, which was quite daunting.
Dealing with those symptoms must have been tough. I recall my own struggle with COVID-19. It wasn't easy, especially at our age. Recovery may take a bit longer before we feel like ourselves again. Did you feel overwhelmed or discouraged during that time?
For me, being in quarantine brought its own set of challenges, particularly with mental health and the feeling of isolation. However, I'm fortunate to have a supportive family and a generally positive outlook on life, which really helped me through those tough times.
That's wonderful to hear, Thiru. Before we conclude, I'd like to ask about something crucial. Hand hygiene. How did you manage your hand hygiene while also taking care of your psoriasis?
During that time, maintaining my psoriasis while following hand hygiene guidelines required some careful balancing. I avoided alcohol-based hand sanitizers as they could irritate my skin. Instead, I used non-alcoholic sanitizers and made sure to moisturize frequently with creams and ointments that were gentle on my skin.
If there's one advice you could give, what advice would you offer to other patients with psoriasis who are facing similar challenges?
The most crucial piece of advice I can offer to other patients with psoriasis is to be proactive about your health. It's important to understand the factors that could increase your risk of severe COVID-19. If you think you might have the virus, don't delay. Get tested as soon as you notice symptoms. It's equally important to consult your doctor early. There are treatments for COVID-19 now.
Thank you so much for sharing your story, Thiru. Your journey teaches us that resilience can emerge even in the toughest situations. If you or someone you know encounters a similar situation, seek support and consult a doctor immediately. As Thiru mentioned, COVID-19 is treatable.
If you know anyone at risk of severe COVID-19, especially those over 60 or with underlying health conditions like diabetes, asthma, cancer, heart or lung disease, encourage them to speak with a healthcare professional about specific treatments for COVID-19. Know, plan, go.